Hi, and welcome to the Law of Fojo podcast. I am your host, Robert Fojo, and I'd like to welcome my guest for today, Tammy Clark. Tammy, thank you for joining me. Thank you for your time.
Hi, Robert. Thank you so much for having me. It's great to be with you this morning.
My pleasure. I wanted to have you on to talk about the issue of masks to combat the spread of COVID-19. This is May 2022. We're well north of 2 years into this so-called pandemic. And I thought we were well past the issue of whether or not masks should be used as a tool in combating the spread of this virus. But we're seeing, just recently, Philadelphia went back to its indoor mask mandate and then abruptly rescinded it. Boston public schools still require masks for students. We're seeing some daycare still doing it. We're seeing reports of this so-called fifth wave emanating from New York City, and we're hearing reports about this wave either extending or a new wave this fall. So obviously this issue is not going away, and you and I have worked together on some of my cases, and I've learned a lot from you, and I thought it would be helpful to have you on to discuss not only your expertise and how it relates to this field, but the issue itself, whether or not masks are helpful in combating the spread of COVID-19, what approach should be taken in determining whether or not masks should be used at all, and whether there are any harms that may result from the use of masks. So could you just, and I've seen your CV, it's very extensive, it's very impressive. Could you just explain what it is you do and how it relates to this issue?
Sure. And thank you. Actually, thank you for giving me the opportunity to kind of set the foundation by discussing the fields of industrial hygiene and occupational and environmental health and safety. Those in my career field, my credentials involve industrial hygiene, occupational, and environmental health and safety. So I'm credentialed in the worlds of occupational and public health profession. So I have a business degree. I have a business background. I've owned my own consulting firm working in the fields of industrial hygiene and OEHS for nearly 20 years. I also am credentialed in construction health and safety. I've got many, many government certifications through OSHA, through the DOT, through EPA. I'm highly government trained. I work with government agencies. I've sat on infectious disease control boards within hospitals, pandemic planning, preparedness, and response teams, working with local, state governments, and working with the federal government as well. I live in the state of Michigan, so many of my credentials are state credentialed, like Michigan Department of Transportation, and then many of my credentials also are federal, some from the federal agencies of EPA, DOT, and OSHA. So I have been a credentialed OSHA expert for 15 years at this point, and I have led hospital systems, construction teams, many different industries, whether it be manufacturing facility, food plants dealing with toxins and things like that, even commercial agriculture farms. I have led those industries, those companies across the country in protective factors, protective measures, proper protocols for keeping employees safe. So it doesn't matter, what type of industry an employee is working in, there are hazards and there are exposures, and those in our fields in the world of industrial hygiene focus on recognition, prevention, and preventive solutions, basically, to protecting people proactively. So that's where we come in. And when I saw the response from the government, particularly with this COVID virus, that's where I stood up and blew the whistle and really became a federal whistleblower, because I recognized, being highly government trained and government credentialed, I recognized that what the government was doing was abandoning their own legally required response that dictates those in our profession with pandemic response, protective factors, emergency protocols, things like that. And over the years, I have testified as a legal expert witness in court cases for my clients as their consultant and advisor. I'm also an expert witness, a subject matter expert in the areas of PPE, protective factors, respiratory protection programs, and hazard mitigation, things like that. So I knew darn well that what was going on was not only totally illegal, an illegal response by the government, it was criminal, because what it did was it violates OSHA's own existing standards and puts people at a greater risk because of it. And I knew that was going to happen. And I knew the harms that we have seen, particularly with children, were going to happen. And now the studies that are just flooding in the market that are coming out, study after study after study, good randomized controlled trials are now proving this. So, that's my background. That's where I'm coming from. And that's why I'm blowing the whistle. And many of those in my profession and my colleagues are as well.
So you talk about industrial hygiene.
Mhm.
If someone were to ask you, with respect to your opinion on mask use to combat the spread of COVID, if someone were to ask you, well, you're not a doctor, you're not a physician, what do you know about this specifically? What's the difference between your expertise as an industrial hygienist and a physician's expertise with respect to mask use and whether it's appropriate in a given circumstance?
Yeah, and that's a great question. And that's probably the number one thing that opposing counsel always attacks me on. They go right there. You're not a doctor. You're not a white coat. Well, the reason they say that is because the government has been pushing doctors and healthcare workers to the forefront of this whole conversation. They've been putting those doctors and nurses on television programs. And, the number one thing you can do to protect yourself is to wear a mask. But I would stop and say, hold on here, time out. We all need to stay in our lanes. Professionally, a doctor, a nurse, or a healthcare provider is absolutely not credentialed to be speaking as a respiratory protection expert, credentialed on PPE, fit factors, disease mitigation strategies, and all of that. So those in my career fields of industrial hygiene, our job is to proactively assess, recognize, prevent, and control hazards, pathogens, whatever it might be, whether it's a chemical in a factory or whether it's a pathogen in a hospital environment or out in the public. So a doctor and healthcare workers work in the field of medicine. They practice medicine and they heal. Those in my career fields of industrial hygiene, we protect and we prevent. And so two very different fields, but at the same time, we do work together collaboratively. I'm not bashing doctors and healthcare workers. However, they are guilty of malpractice when they stand up there and they speak on something to which they are not credentialed and they are not trained. For example, a doctor knows about his or her PPE because those in my career field come in every single year and we bring them through their training. We teach them how to properly don and doff their PPE, how to use it, how to dispose of it, what type of PPE they need to be using for what particular pathogen, and then how to properly assess and things like that. So the only things that they know about PPE is what those of us in my career field, in my profession, teach them and train them on. And we don't teach them on everything we know. We only teach them on what applies to their particular work. And so it's very, very important that people understand when a doctor stands up there and tells you to wear a mask to prevent against an aerosolized respiratory protection disease, they're guilty of malpractice because they're 100% wrong. The only thing you can wear to protect against an aerosolized infectious disease would be it looks like a space hood. It's called a powered air purifying respirator.
Like in the movies.
Yeah. And if you watch shows like The Good Doctors or Grey's Anatomy, right, they're doing it right. You see them come into a contagion environment where it's a highly infectious, disease ward or something like that. And those healthcare workers are all wearing that fully enclosed, completely enclosed respirator. It's a powered air purifying respirator with their own source of breathing air. So the respirator is not filtering anything out because it's not approved to do that. It won't filter out something that tiny. The only thing you can do to protect in a contagion environment is to completely isolate the worker. So the surgical mask is not designed at all to protect against aerosols. It won't. There's gaps on the bridge of the nose, on the sides, and the cloth itself is too porous. It's not rated to stop an aerosol. The only thing a surgical mask will do is to prevent bacterial splashes from coughing, sputum, sneezing from the doctor into an open body cavern of a patient. It's not designed to protect the doctor the other way, or even the patient from aerosols. So we've gotten this all wrong. The way that we have handled this pandemic has been 100% inaccurate, and it's not been factual, and it's been driving people like me crazy who actually do spearhead, pandemic response and things like that, because we were completely ignored. And so we did everything wrong.
It seemed to me when the narrative was developed 2 years ago to wear a mask, to protect yourself, to protect others, it seemed intuitive to me that these cloth masks were not effective at preventing spread. I mean, at the time, and I remember because one of the first lawsuits I filed on behalf of a client was to challenge a municipal mask mandate in Nashua, New Hampshire. And I was looking at studies. I had a different expert at the time. I hadn't come across you yet, but I was looking at studies concerning masks and preventing the spread of influenza, and those studies concluded that masks were not effective at preventing the spread of influenza. And so it seems like we had the information then and the data then to support the idea that recommending a one-size-fits-all mandate for mask use in a community would not have been effective. So I don't understand why we pursued this approach.
Well, it really begs the question, because those particular studies I'm familiar with that you're talking about, that pre-COVID, going back to 2015, 2013, they actually did true randomized controlled trials, which if you're going to look at a test or a study, it's incredibly important that you use a randomized controlled trial that is done properly, is funded properly, that there's no fraud in the funding and things like that.
What is a randomized controlled trial?
So a randomized controlled trial is really the gold standard of scientific studies. And if people are not used to, they don't work in the scientific field or the medical field, and they're not used to reading trials and studies, it's really easy to fall for objective or conjective biased opinion pieces put together in a narrative to support a position. And that is not science. Okay. That the randomized controlled trial it's what it says. It's a controlled trial with a very good control group, a test group, a placebo group, and a control group. And it's very carefully monitored, and it's not biased. It's not. So the funding of it, for example, there cannot be a conflict of interest in the funding, because the outcome will almost always be skewed. And that's what we've been seeing with the only two tests that the CDC have produced that say these are randomized controlled trials and they show masks work. They showed one coming out of Bangladesh, and it was so skewed, and it was just wrought with fraud. And so, and you can pick that apart, and you can find that if you understand how to read studies and trials. But if you don't, it's really easy for people to just go, oh yeah, look at that, mass work. But they don't even realize, they don't understand what they're reading. So a randomized controlled trial really is the gold standard, because it's an unbiased, truly scientific method supported test or trial that gives us very good objective results. So anything else, and the CDC has been relying on this conjecture and, stupid things like this hair salon study. Well, these people in this hair salon got it and these people didn't. So there you go. I mean, it's nothing but observation. But they're actually using it in court cases. I was in a court case with the state health department in Oregon, and the state health department doctors and the CDC doctor both relied on this study. And we actually, were able to tell the judge, this should not even be admissible in court. This is not scientific evidence. It is nothing but conjecture, but that's what they're leaning on. And they talk to you like they talk down to you as if you're stupid because you don't go along with it. So there's been a lot of this false narrative that's been pushed. And you're right, it begs the question, why? When we have hospital systems that have done randomized controlled trials, proving you cannot stop the spread of an aerosolized respiratory infectious disease with a surgical mask, a cloth mask, even a KN95 mask. These doctors and nurses and healthcare workers work in them all day long, all the time. So why are they still getting, high rates of influenza spreading around in the ORs and the surgical suites? Why is that? Well, because those particular medical devices, facial coverings, even a KN95 or an N95 entry-level respirator is not rated to control that particular type of hazard, and it won't. That's why. So we know this. We have known this for years, which is what to me says that there's something very nefarious going on here. And I'm not a conspiracy theorist, but I'm a highly credentialed expert in this field. And I'm looking purely at the science, purely at the background and the legal regulatory background that dictates my profession and requires us to do certain things. And I'm going, what is going on here? Why have we abandoned the multidisciplinary approach to pandemic response, planning, and preparedness for the first time in history, when we have all the scientific, medical, regulatory, technical data that we need to know this is what we based everything on?
Right. What is can you identify and walk me through the multidisciplinary response that you're referencing?
Yeah. So going back to the 1950s, the National Safety Council released protocols that those in our career fields who work on the forefront of pandemic planning, preparedness, and response, or in the occupational or an environmental setting, whether it's in the workplace, the occupational environment, or the environmental health and safety environment, which is the public at large, there are protocols, government protocols that dictate what those in our career fields must do in order to control hazards, protect people, implement hazardous mitigation strategies, respiratory and protective factors based on what it is that we're seeing. So the multidisciplinary approach always includes working with epidemiologists and virologists, those in our career field of OEHS, IH, and OEHS professionals to protect, and then doctors and healthcare workers to heal. Okay, so what we usually do is we start with the epidemiologist and the virologist. They determine what is it that we're dealing with, what type of pathogen, what are its characteristics, what's the nature of this pathogen, and then they determine, they plot and predict, how do we think this is going to move based on what we're dealing with in the characteristics. Then they pull in those of us in our career field who are responsible for protective factors, for disease mitigation strategies, based on what we know we're dealing with. And we determine, okay, if this is what we're looking at, this is a highly infectious respiratory disease, then what sort of protective measures do we need to use, knowing what's rated to protect that type of a pathogen? Okay, and so then we have to follow what's called the hierarchy of safety and controls. Mm-hmm. And this is our disease mitigation strategies or pathogen mitigation strategies that must be implemented by law per government standard. And this is what we completely ignored, because the hierarchy starts on the very top with what's called substitution. Or elimination? Can we eliminate this particular pathogen or hazard? Well, no, we could not eliminate COVID. So then we go down to the next one. Can we substitute it? Can we substitute this chemical for something less toxic? Maybe when it comes to COVID or a pathogen, no, you really can't. So you keep moving down the hierarchy. Could we isolate people? In some cases, we could isolate people. We could have isolated them in special disease wards, and the healthcare workers in those wards would have worn fully suited cappers and pappers. And in other cases, we could have isolated patients who were infected, like in the nursing home situation. We did not isolate. What we did was we commingled. We did exactly the opposite of what we should have done.
They did that in New York.
Yes, and in Michigan here too. I mean, really crazy high numbers. So then we keep going down the hierarchy. If we can't, eliminate, substitute, isolate, then we utilize engineering controls. And what is that? Engineering controls would be something that you install like on your HVAC system to increase air cycle exchanges, and it pulls aerosols up and out of the breathing zone where they normally would stay suspended for days, even weeks, if it's not pulled through dilution and destruction technologies. So, for example, in hospitals, hospitals and surgical suites, they're cold, they're windy, it kind of feels like a wind tunnel. Well, that is an example of engineering controls, because in a hospital system, we can't eliminate, substitute, or isolate for the most part. So then we utilize engineering controls, which are very, very effective at pulling those pathogens up and out of the breathing zone so people are not being infected and contaminated. And these engineering controls are examples through ASHRAE. Engineering controls are examples of why, based on some of those previous studies for healthcare, that healthcare workers were not being protected. They were still getting disease. OSHA now requires healthcare systems to implement these engineering controls because it's the only proven scientific way to protect. And that's all we would have needed to do. So hospital workers work in these very carefully controlled micro environments. It's colder, lower relative humidity, temperatures lower, and it feels windy and cold. Like if you ever go into for surgery, you're freezing, right? You feel like it's windy and cold. Well, that's because there's increased air cycle exchanges pulling pathogens up and out of the breathing zone in those areas so that we're not all infected. It's a very effective strategy and control measure, and that's all we would have needed to have done. And so we could have stopped right there. We wouldn't have needed to keep going down the hierarchy, which, if you notice, and you've seen this, so you're familiar with it, the very last, looks like an upside down inverted pyramid, right? So the very last control on the bottom is called PPE. And we never put people in PPE unless we have not been successful in engineering the hazard out. And if we can't, we go through the whole hierarchy and the hazard still exists, whatever it might be, a pathogen or a chemical, then we put people in PPE to protect them. But the reason it's always the last line of defense is because if that PPE fails for whatever reason, the person is still exposed. There's still an exposure potential. So our government
I'm
skipped right
sharing.
down.
You see it?
Yep, there you go.
Okay.
Perfect. There you go. So our government skipped over all of this hierarchy and went right down to PPE and
Mhm.
threw everybody in facial coverings as a one size fits all blanket approach, which is also never, ever acceptable. And we can talk about why that is. If you're going to use PPE, you must by law follow OSHA's PPE and respiratory protection standards. You cannot just slap a facial covering over somebody's face and mouth and nose, restrict their normal natural breath and gaseous exchange, and tell them to go do their work. Never. That is totally illegal according to OSHA's own standards. So they violated the government protocols and the hierarchy of safety and controls that dictates our response. They violated OSHA's own PPE and respiratory protection standards by ignoring the science that has existed since the 1970s that says you cannot just put somebody in PPE without first doing a health risk assessment, a a fit test and a fit factor test and all of that. There's all kinds of protocols if you're going to put somebody in PPE that you must follow. So everything we did was completely illegal, wrong, and it did nothing but set us up to create a greater hazard.
I mean, it seems like we just did it backwards. We started with,
100%.
and
Yep.
it was almost as if I spoke to someone else about this. I spoke to someone on the podcast about a month and a half ago about the PCR tests, and I know you're skeptical of those as well, and for right reason, as am I. We talked about how the testing approach to diagnosing COVID, the way the government approached it was they tried to adopt an approach that was easy to scale. And it seems like that's the same methodology that was used here. We need something that we can scale rather than this more nuanced, individualized approach that you're talking about. Is that accurate to say?
Yes. And what really, it is absolutely never, ever possible to outrun a virus. Let's just understand that.
Right.
There are millions of viruses in our world, and it is not something that we should ever be afraid of.
Mhm.
We live with pathogens, bacteria, viruses in our bodies, in the air around us. That's how the world works. It's not something we should be all terrified of. And this particular virus has a greater than 99% survivability rate for the vast majority of the population. No different than the flu or colds or anything else. But what people focus on is, yeah, but so-and-so died. Well, first of all, those numbers are very conflated. We know that. Those numbers are very skewed. The number of people that the CDC said and the World Health Organization has said have died from COVID, we now know they have actually admitted they died, the majority of them, with COVID. Big, big difference here. Yet they're scaring everybody by saying, this is the amount of deaths, so we all have to do this. Well, and it's not something that is scalable. You cannot take this approach because, first of all, it's not going to work. You can't outrun a virus. Second of all, you need to understand what the actual control measures are and implement those instead of trying to make this fit your narrative. Okay, so the controls that we've always had is the dilution and destruction technologies with engineering controls. If the government would have just mailed everybody a $400 check to implement one of these, I call it an iWave Air. I don't get any money for that, but it's the best one that you could put on your home. I have one in my home. It kills greater than 97% of all molds, bacteria, pathogens, viruses in the breathing zone in the air. Okay, so you could have installed something like that on every home for $400 instead of telling everybody to smother themselves, restrict their normal natural breath, reduce their oxygen intake, and increase their carbon dioxide output because we're trapping and rebreathing that expired waste gas into our body, creating all kinds of greater hazards that we know, including psychological. People get anxious, they're frustrated, they struggle with that. We've created such a mental health issue with our children and with all of this craziness. We could have stopped with a $400 check to every family instead of telling everybody stay home, don't work, send you thousands of dollars, destroy the economy, destroy businesses, create these health issues because they abandoned their own protocols. And the thing that really gets me, and the reason I become very vocal and have been kind of thrust onto the stage as a global whistleblower is because I was so angry about it. Because I know that they know. And the reason I know that they know is because they have trained me. I get my certifications and my credentialing from the government who's taught me how to control all this craziness. And yet now they're ignoring me. My credentials don't matter. I don't matter. And they're just going to do exactly the opposite of what they know works. somebody's got to stand up and blow the whistle on this and shine the light on this.
Yeah, I agree. Why, at the very beginning of all this, people like Dr. Fauci were quoted as saying that masks were not effective. I mean, there's a very famous email chain now in which he advised someone, I forget who it was, about how masks were essentially useless against this virus.
Yeah, he knows.
So why? I mean, you're saying that they've abandoned the training, they've abandoned the predominant approach to something like this. Was it incompetence? Is it just what is it? Why did they do that?
That has been the biggest thing. And I was scratching my head about a lot of this. And when the children, when they were saying kids are going to have to wear masks, go back to school, I actually laughed, about spit my coffee out across the room. Like, there is no way we would ever do something like that. Well, and then they did. And then I had this sick feeling in the pit of my stomach that something nefarious has got to be behind this, because we would never do this to our children. We know that the oxygen deprivation that is caused by restricting normal natural breath will create long-term brain damage in the frontal lobe of children. We know this. So why would they be doing this? Well, that begs the question. And as I started looking into it and researching it and more, and all they did was drove this narrative of fear. And I'm like, this is propaganda. It's not even true. What are they trying to accomplish? What's the point here? Well, then you start, really asking questions and digging, and it leads you down some like, oh my gosh, I'm going to sound like a conspiracy theorist if I say this, but I'm not. I'm a conspiracy realist. What's happening is real. It's actually really happening. And then we just find out that the Biden administration has just released, released information. Well, he didn't release it. He did it in secret in January by recommending amendments to the World Health Organization's proposal that we all abandon our national sovereignty and allow the World Health Organization to dictate all of our national health response, global health response in the event of a pandemic or emergency. And President Biden submitted in January amendments that all these other nations are signing on to now. And we just found out about this in April. And this is very important because in 2 weeks, we are right now poised to give up our national sovereignty, individual choice, state choice, federal choice, and give everything over to the World Health Organization to tell us what we need to do for health response in the event of a pandemic. This is setting us up. This is setting us up for global governance. And that right there, when this started coming out, I thought, there it is. That's what's going on, because they have scared people enough that people don't know what to believe. They don't understand the facts like I do behind the scenes because they don't work in my profession. And so they're believing what they're hearing. And it's just been fear, fear, fear. Well, if you go back to Nazi Germany, what did they do? How did they get the people to give up their rights and willingly comply? By making them afraid, by fear, through a fearful propaganda. And they have done this exact same thing. It's the same playbook right now. And people are willingly giving up their rights, willingly wearing a mask. They think they're doing this out of kindness for their neighbor. This, virtue signaling has become a real issue. And what they're doing is they're actually setting their children up and themselves up for greater health hazards unknowingly because they're believing a lie. But what it's also doing, it's conditioning people to give up their rights. Well, I guess we have to lay down our rights for the greater good. So now it's real easy for the federal government to step in and say, we're all going to give up our rights for global governance in the event of another pandemic. And when you look at it from that 10,000-foot view, it's really easy to connect the dots and see what's going on here. So those in my profession, those of us in my profession who own our own businesses, we don't work for the government, so we're not suppressed. We have been blowing the whistle and just shouting this from the rooftops because we have got to stop this before we are swallowed up by a global one world government that will dictate all health response globally coming very soon. This is really an imminent threat that we're on the brink of right here.
You had mentioned that to me a little while back about the amendments that the Biden administration proposed, and so what does that mean? And I confess that I haven't really looked into it any further since we spoke about it. And now you're obviously going into it now, but so what does that mean? Does that mean that we would, rather than have the CDC dictate or provide guidance as to how we should respond to a virus outbreak, we would be looking instead to the World Health Organization to provide that guidance.
Correct.
I see.
And nobody knew this. This was done in secret. And now Congress is really scrambling right now. And people are really representatives that will be the delegates at the Geneva summit coming up are going to be the ones to vote on this. And so now we've only got 2 weeks. Biden did this and submitted these amendments stating that in the event of a pandemic, of a health crisis, another global health crisis, all the nations of the UN who represent over 97% of the world's population will sign a treaty that they agree in an event of a global health crisis, they give up their sovereignty. They give up their ability to determine healthcare response or pandemic response protocols in that country. And they give the control and the power over to the World Health Organization, who would enforce through UN soldiers, UN peacekeeping soldiers. And this is why you're already seeing UN soldiers move into Canada, move into Great Britain, move into other countries, and they're flying the UN flags in Canada, in Great Britain, in Australia. This is part of this global takeover. It's already being done and being implemented. Many countries have already signed on to this. And so it's a really scary thing when you realize the Biden administration did this in January without any consent or knowledge from Congress or anyone else. We did not find out about this. In other words, Congress did not find out about this until April 16. Now they're voting on this in 2 weeks. I mean, this is crazy. This is absolutely crazy. And we have got to get to our delegates, our US representatives and congressmen and women, and tell them, do not support this. We do not agree to give up our national sovereignty and give control of health response for every single individual Americans to the World Health Organization and enforce their UN soldiers on our soil. We do not consent to that. But listen, in 2 weeks, if they sign on to it, what are we going to do?
It seems to me, and I'm a huge proponent of decentralization of local communities developing their own solutions to address their own issues rather than relying on a federal response to everything.
Right.
It seems to me that in the field of health, that would be particularly applicable, wouldn't it?
Yes.
Every community should probably assess its own health needs and develop its own responses rather than guidance from some federal authority or, God forbid, some global authority.
That's absolutely right. And that's why in my work, I have worked with hospital systems and I have worked with local and state governments. And we assess what's going on. Again, working with epidemiologists and virologists because we can plot and predict the nature of the spread. And there's many areas that, for example, very rural communities that are probably not going to be hit as hard as an inner city like Detroit or Boston or something like that. And so you can take preventive measures accordingly. That's why it's never, ever a one size fits all blanket approach to pandemic response, to wearing PPE, because you have to look at the risk reward, the benefit analysis, and you have to determine, because we know that measures that we put into place will have some side effects, will have some, as Anthony Fauci called them, unintended consequences. He nailed it. He was right about one thing in the very beginning. Wearing a mask could lead to unintended consequences because he knew darn well what would happen if we did that. And so in the beginning, he was saying, don't do that. Well, this is why we have to have the autonomy and the freedom and the ability as local counties and governments to be able to determine the needs for our constituents and our citizens in our area and decide for themselves. And so, that's what those in my profession have done, have worked with those different communities and said, here's your risk factors. And so here's what we need to do for you. And that's why these plans look very different for different areas. So you're exactly right.
The approach that you're advocating that should have been used and that was abandoned, is that an approach that could have been used, for example, in schools where mask mandates were so prevalent over the last couple of years?
Absolutely, and they should have been, because we can install these upgraded HVAC systems on even commercial buildings. And the hospital systems, like I said, they're already installed by law. OSHA requires them to follow these engineering standards called ASHRAE standards to increase and improve the air quality of the indoor building. We could have done this on schools. And in fact, we could have done an analysis or a risk analysis or assessment on a building, done some air sampling. We could have determined the quality of the indoor air, and then we could have implemented protocols, engineering controls that would have increased this air cycle exchanges per hour, and it would have led to dilution and destruction through capture ventilation with HEPA filtration, and we could have purified the air. And that's all we would have needed to have done. But instead, we increased the spread because kids are boogery, dirty messes. Let's just, we all know that. You put a facial covering on a child all day, and what are they doing? Pulling it, touching it, sneezing in it, coughing in it, and then they're touching it. Then they slap it on their desk, contaminating. It's called cross-contamination, contaminating that entire surface. They trade. Oh, I like yours better than mine. So they're trading masks. I mean, we created a way greater spread. And this is why we never do this. This is why we purify the air. And we could have used things like ultraviolet light to sanitize surfaces instead of the toxic hand sanitizers. There's so many things that we know scientifically and that are required by us to follow, working through that hierarchy, that we just didn't. And we created so much more spread because of it.
I think I had the same reaction you had when it was suggested that children would have to wear masks to return to school. I just think I think a child being told to wear a mask is a joke.
It's child abuse.
I used to say that. I said that in a TV interview and I was excoriated for it.
I know, but
it
is.
It's what are some, let me ask you this. What are some of the harms that could result from the prolonged wearing of a mask?
So some of the harms that have resulted from prolonged mask wearing, and this is the reason OSHA has their standards in place now. Going back to the 1970s, OSHA created what's called a PPE and respiratory protection standard based on what we saw, based on the harms that we saw from allowing people to cover their face and their nose and their mouth, restrict their normal natural breath, reduce the oxygen intake, increase the carbon dioxide intake. And the results of that created such a greater hazard that OSHA actually created standards to prevent that. It's illegal to do that unless you follow some strict protocols. So the unintended consequences and the harms are, number one, the body is struggling for demands for oxygen. I don't care what anybody tells you, that people will tell you, oh, it does not reduce oxygen. It does not increase carbon dioxide. That is such a lie. Then why does OSHA have their standards and their protocols in place? Tell me that, because the science has existed since the 1970s. We know it does. Yeah. This is why we're not allowed to do that.
Yeah, I recall when we were deep into the mask mandates, late 2020. I had a court hearing, and courthouses, essentially anywhere at the time, you had to wear a mask. And I was wearing a mask, and at the time I'm training for a marathon. I put a mask on, I go up a flight of stairs, and I'm literally out of breath, which is not something did not seem right. So I agree with that. I think that the notion that it does not restrict your ability to breathe, or rather, and conversely, it increases the amount of carbon dioxide that you're taking in, has to have an effect on you.
It does. It absolutely does. And we know that this is factual because the studies going back through the NIH and the National Safety Council going back to the 1950s through the 1970s, and then observational science, when you have people, you have contractors or whatever, if they have paint fumes or drywall dust, just, putting on their own homemade cloth mask before the standards existed to try to, reduce the fumes or the particulates that they were breathing in. They were getting headaches, nausea, vomiting, feeling very ill, passing out, heart attacks. We had all kinds of things like that happening from people covering their mouth and their nose because we were designed to breathe freely. You restrict your breath, your oxygen, you cause that buildup of the waste gas that has to get out and dispersed into the ambient air around you. You cause that to build up by trapping it and rebreathing it. In addition, you're reducing your oxygen intake, and it is absolutely true that it does. This is why OSHA created these standards in the first place. So the signs and symptoms, the first signs and symptoms that the body is struggling to meet demands for oxygen is, number one, fatigue. This fatigue-induced syndrome is what we're now calling it. Oxygen-induced fatigue syndrome. So what happens when you cover the mouth and nose? What are your kids coming home like after being in school? They're tired, they're grumpy, they're irritable. You can't hardly get them to do their homework. This has been the number one problem that children in particular have complained of, is that extreme fatigue. And some adults know it too. Like you said, you just ran up a flight of stairs, you're a marathon runner. That should not be an issue for you. And yet you're sucking air, you're sucking wind. People know this everywhere who've been forced to work in masks. You're tired. A headache is the number two. It's no different than if you go out to Colorado and you hike up Pikes Peak and you get a headache, pounding headache, right? Or they call it mountain sickness. All it is the fact that your body is being exposed to an oxygen reduced climate and you're not used to it. And it's causing the body's responding to, struggling to meet demands for oxygen. And so those signs and symptoms are the fatigue, headache, nausea, vomiting. You can pass out. Yeah, absolutely. You can pass out. And we've had a lot of instances like that with contractors, with factory workers, and children playing sports. You've seen probably many of those stories where kids pass out on the basketball court or whatever. And it's just been very, very hazardous. And that's not even getting into the damage to the frontal lobe of the brain that prolonged oxygen deprivation will do. And you can't see that. It's causing brain damage and long-term damage for these children that cannot be seen externally, but it's going to cause learning disorders and behaviors and the development of neurological disorders younger down the road. And then, of course, you have things like perioral dermatitis, or they call it maskne. That's a staph infection, a bacterial staph infection on the skin from that prolonged moisture, bacterial buildup. And then the internal perioral dermatitis that's causing gum disease, bad breath, which is indicative and is on the forefront of that total holistic body health. So we have done so much damage to our population, and the mental health crisis that we have created among our children and our young people. Suicides are through the roof with children. They can't deal with wearing this mask anymore. They can't, they're struggling in every way. They've been isolated from their friends. They can't breathe. And so suicides have gone through the roof with children, depression, children entering with anxiety and behavioral disorders from the ages of 5 to 11, entering mental health institutions, going to the emergency room visit. Those numbers were up by 24%. I mean, it's crazy what we have done as an unintended consequence from something that never should have been done in the first place. All we would have needed to do is install increased ventilation systems, increase our HVAC systems on our buildings, on our commercial buildings. That's it. We could have stopped right there. That's all we've ever done. So let me just tell you, this is why OSHA does not have a respiratory infectious disease standard. They've got lots of standards for controlling health and safety concerns, but they do not have an infectious disease standard. And the reason is because we already have the science and the technology that exists to control the spread of infectious disease. We already know what to do. We've been doing it for many, many, many decades. So what's different about this one? Nothing, except they were using this particular disease, this virus, to implement a greater plan. And that's now very evident.
Yeah, I too am not a conspiracy theorist, but as I have seen the various phases of this experience, this 2-year ordeal play out, I was connecting the dots as well. And the only conclusion I can come to at this point, the only rational, reasonable conclusion I can come to is that there is some other effort in play here. Because none of this stuff made any sense. When you have government officials admitting that masks were useless, but then recommending widespread community use of masks, and then local and state governments followed suit. And obviously, we all know about all the other measures that were implemented, such as vaccine mandates and such. There's no rhyme or reason to any of this unless you consider the possibility that there was some other effort in play. And I don't know what that is. I'm not qualified to talk about it. I know that a lot of people have done more research into that issue, but none of it makes any sense to me.
Exactly. And that's why if it doesn't make sense, it would be irresponsible of us to not ask the questions. It would be absolutely irresponsible for us to just follow blindly with things that violate known scientific and medical protocols, known law and regulatory requirements. Okay, we've always managed pandemics in this way and very successfully. So why are we taking the exact opposite approach to this one, creating all kinds of greater hazards, which is the number one no-no in my profession? In the medical profession, it is do no harm.
No harm.
And I work as a preventive health specialist, but I work more in the scientific, as an exposure science in the scientific field. And the number one no-no in our profession is do not create a greater hazard. So when you're seeing this happen, and you know it's happening, it would be absolutely irresponsible for me to not say something, right? Because if I didn't and I just went along with it, I would be violating the ethics of my profession.
Right.
And so I can't do that. We take an oath in our profession, and I have to abide by that oath to protect those in my profession, protect. And that's why I say those in the medical profession and doctors and nurses and healthcare, they heal. But we have taken an oath to protect. So when I'm seeing something that actually is not protecting people, it's actually putting them at great risk of harm, I have to abide by the ethics of my profession and say, whoa, time out. What is going on here? It would be irresponsible of me not to ask these questions.
Other than the Bangladesh study that you referenced earlier, has the government in any of the cases that you've worked on, or in any other situation, have you seen any other study or evidence cited by the government to justify the widespread use of masks?
I have seen no credible scientific studies. The only thing that I have seen and that they have entered as exhibits are things that are just conjecture, biased observation pieces, biased opinion pieces. And it's been very obvious when you look at that there's no science behind this. If you follow the scientific method, and as an exposure scientist, I'm very used to working with scientific studies, that nothing that they submit or enter is an actual scientific study. And it's not hard to pick it apart. And then when you challenge them, they say, well, this is just so new that we're just having to kind of, go with what we knew as it's developing. And I say, no. We never do that. We never. Okay, if you're going to call yourself the science and you're going to flip-flop on your scientific recommendations 4 times in 18 months, that is the 180 degrees the opposite of real science. You're not even following science, yet you call yourself the science. And science doesn't flip-flop that much. We already have known strategies, and we have the scientific method in place that has proven how to control and mitigate. So when you introduce something that's just observation and they say, well, this is new, we're having to follow the developing. No, this virus is not new. There's nothing really that novel about this. And it is mutating just like every other virus does. But the thing is, as viruses mutate, they get weaker and weaker. They may become more contagious, but their signs and symptoms are much less. In fact, you got to go take a test to know if you even have it. So what's the issue here? Why are we having to adapt all these protocols, put in more and more stringent requirements as the symptoms of the developing and emerging mutations get weaker,
right,
to the point where you don't even know you have it? But yet we have to throw everybody in all these crazy strict protocols. It's ridiculous.
There was one of the cases I had in the one in Massachusetts. You were not involved in that one, but that was the one we sued 18 school districts and the state, the Commonwealth. At the time, last fall, they had the state had implemented a statewide mask mandate for schools, and obviously all the school districts had to follow suit. And on the eve of the injunction hearing, so I'm always interested to see what the government's going to come up with to justify
right
the mask mandate. Because one of the issues inevitably that comes up in any of these cases is it effective at preventing spread? Because you have to demonstrate whether or not there's irreparable harm or whether or not there would be any harm from rescinding this measure. And they came up with a study. Now you may have seen this one. It was one that they conducted out in Maricopa County in Arizona. They looked at a whole bunch of school districts in that county, and the study concluded that the use of masks led to a decrease in the number of COVID cases. And I looked at it, and I just on first glance, I noticed the time frame of the study, it was done in July when most of those schools were closed. So
That's exactly right.
it was, and I could not believe that something like this would even be published, let alone used in a court case. But
Yep.
yeah, go ahead.
No, I've seen this, and this is
Yeah.
why I've said these studies are not actual randomized controlled trials. They are not credible. They are wrought with fraud. They are intentionally entering evidence that is not evidence. It is conjecture, it's biased opinion pieces, and they're playing a clever game of wordsmithing, and they're trying to convince people of something and saying it's science when it's
Mhm.
fraudulent. And this is what I have been up against. This is what I've been dealing with. And I've had to really closely look at some of these tests and in court cases. And this is why I say I want to see the exhibits before we get into the court case, because I
Right.
know darn well the exhibits they're entering are probably nothing but fraudulent, objective, biased opinion pieces. And I need to really be able to look at that and say, because they're going to argue it to the death and say,
Mhm.
this is why. Well, I need to be able to come in and say as a rebuttal witness, actually, that's not even factual, and be
Right.
able to point out like you did, because this is what they're doing. And it makes me wonder, like, there's nothing scientific about this. You're lying. This is a lie. Why are we purporting and pushing a lie unless there's some nefarious intent behind it?
Right.
Because what we did to all of our school children, who, by the way, do not suffer from COVID, the one segment of our population that does not even suffer from COVID,
I know.
but we're creating very serious health consequences for them by doing something that we absolutely do not even need to be doing in the first place. When do we ever, deal with cold and flu season, colds, flus, strep throat, pneumonia, stuff like this? We don't even think about it. We just send our kids to school, and now it's cold and flu season. We start pumping them full of vitamin C every fall when they go back to school, and that's it. We don't worry about it.
Right.
Why now are we freaking out about this? That doesn't even affect our children, like even the flu would.
It infuriated me when indoor mask mandates for restaurants, movie theaters, sporting events were all lifted, but we kept kids in masks in
That's
schools. I
right.
mean, was there any rationale that you're aware of for that discrepancy?
No, absolutely not. And I'll tell you where this came from. This was driven by the teachers' unions.
Mhm.
This was 100% because of the teachers' unions. And the other thing is, it was by the ESSER funding, federal funding.
Mhm.
These schools were told that they would receive millions and millions of dollars from federal stimulus, COVID stimulus dollars, if they complied with COVID-19 rules that the Biden administration laid out. And that included keeping our children in masks, testing, quarantining, social distancing, and vaccines.
Right.
These are requirements. And so these schools, don't let your schools fool you, and don't fall for these, you know, upgrade, we're going into millage season or whatever. We got to vote on this millage. Do not let these schools fool you. They are flush with cash right now. They do not care about your children. They are harming your children for money. Money means more to them than your child. So we're creating these great hazards and mental health issues and other health issues for our children, not allowing them to go to school, or separating them, not allowing them to play sports. Or if we do, they got to play sports with their mouth and nose covered, and they're passing out, and their head injuries, all kinds of crazy things for money. This is money driven.
Yeah.
And that's wicked. That to me is really wicked.
Yeah. I requested and I obtained and reviewed in a few instances at least in New Hampshire, is the way they did it. There were these memoranda of understanding between a school district and their local teachers union, which was an addendum to the collective bargaining agreement that they had. And these memoranda included requirements that schools maintain all of those different measures in place, including masks for kids. And that was done. That they had these memoranda as early as in 2021, and then going forward. I agree that at least the mask mandates and all of the other so-called protective measures that were implemented were the result of teachers union pressure. I looked at the ESSER funding document. I looked at some of those, and I'll agree. I don't think it was, the receipt of the funding was not specifically conditioned on implementing those measures, but it was strongly suggested that they follow these measures in order to so they could receive the funding. I mean, you could certainly read it. Someone who is not, um, who doesn't know how to read these documents would likely have, or isn't familiar with these types of documents, would likely have concluded that, Jesus, we better do this stuff so we can get this money. We need this funding because God
Yeah.
forbid. It is.
And then they had to require a response on the ESSER 2 funding. They
Yeah.
had to actually submit a response. What are you doing for your COVID protocols? In other words, I don't remember how many days the school had to respond to that, but they had to write a protocol, or what is your COVID-19 plan, and what are you doing to follow these protocols?
Yeah,
The schools actually had to
no one was gonna say, oh, we don't have a plan. We're not really doing
yeah,
anything.
we're not doing this, right? Because they want that money, and it's millions and millions of dollars. And
Yeah.
you can look and you can find out how much each school district received in funding. In Detroit, it was like $12 million. I mean, it's crazy. So do you think that they're gonna allow everybody to just come back together and take the masks off? No, they're gonna keep their boot on the neck of these kids.
Right.
And our children are paying such a heavy price for this that I just tell people, if at all possible, you have got to get your kids out of these public schools. They are harming your children. They're not protecting them. They're harming them. So it's just crazy.
I have enjoyed seeing parents develop a renewed interest in their local school boards. One of the things
Yes.
I would tell a lot of parents was, we stopped paying attention. You need to get back to paying attention to a lot of the damage that was inflicted
Right.
from these COVID measures was done at the local and state level, not by the federal government. The federal government issued guidance, but the state and local governments are the ones who implemented all this nonsense.
That's right.
And parents are now, you see parents now running for open school board seats, or running and contesting existing school board members, because these people have just they've been there for God knows how long. They don't care about the kids. They're just doing whatever they want. And in many instances are simply just, they're bought and sold by higher authorities. And it's very unfortunate because the kids are the ones who are suffering.
Yeah, that's absolutely true. And we're seeing what the parents have done. Loudoun County, Virginia, flip it. They made that whole governor's race about education. They
Right.
flipped that state very red. Parents are now standing up and protesting and taking over. And it's something that it's our fault because like you said, we were apathetic, but we were just busy living our lives, raising our families, working our jobs, being good, responsible citizens, and then voting like we thought we were properly. That should be enough. But it clearly isn't, because there are very nefarious things going on behind the scenes. And like you, I'm very happy to see parents now paying attention. And a lot of these school board members are resigning. The conflict and the confrontation is just too much for them, and they're resigning. And I love it. I love it. Yeah, I think it's great. So
yeah,
that's what needs to happen.
I've never seen such raw, palpable energy from a group of people, but the energy I have seen from parents in response to the mask mandates, the vaccine mandates in schools has been impressive. And I'm glad that it's happening and that it has happened, because that's what we needed to combat this stuff. There was a study you sent me recently, and it was concerning whether or not the prolonged use of masks actually increased the fatality rate for COVID cases. Can you comment on that or explain that?
Yeah. So when somebody is ill, and this is why even, cancer patients, people that are struggling with immune issues, if you are ill and you cover the mouth and the nose and you restrict breathing, you're lowering the oxygen intake. Okay. So when somebody is ill, you probably have heard of oxygen therapy or oxygen treatment. When somebody is immunocompromised and they're struggling, you're going to give them oxygen therapy, oxygen treatment. It really boosts the immune system. It gives you a lot of energy because oxygen, right, is the foundation of life for all of our cells. And if you don't have enough oxygen intake, you're going to have lower cellular turnover, lower immune function. And so by covering the mouth and the nose and restricting the normal natural breath, oxygen intake, and also restricting gaseous exchange, you actually severely weaken the immune system, which is something I've been concerned about that we're doing with our children, weakening their immune system just right off the bat. So when you're ill and you're struggling, if you have COVID or anything else, and you are wearing a mask all day, you are reducing your immune function because of the reduced oxygen intake. Whereas what you should be doing is oxygen therapy and injecting more oxygen into the body. So it's led to an increased number of deaths. Whereas if somebody had COVID, and they did not have to be, wearing the facial covering or restricting their breath and reduce oxygen intake, they would have recovered much more easily, allowed the body to just do what it does. And this is very concerning, but this did not surprise me. My colleague and I don't know if you've seen any of our videos together, Kristen Megan, she's my military colleague. Okay. So we have started, we met through all this craziness because we were both saying the same things. We're both credentialed in the same career field. We met and we kind of joined forces and started doing some videos and traveling the country together and speaking in front of legislative bodies and in court cases together. But she and I in early 2020, when this was starting, we were saying, we said it vocally, we made some videos and we said it vocally. This is going to kill people. We actually said that. This is going to harm our children and it is going to kill people. Mm-hmm. How do we know that? Because OSHA has known that for decades. People died by covering their mouth and their nose, by implementing a facial covering and then going about their task all day. This prolonged mask wearing will kill you. It can kill you. It has caused heart attacks and other things. And so we knew this and we said, people, this will kill you. You can't do this. This is not healthy. It's not okay. It's actually illegal, according to OSHA. And here's why. And we were just so demonized for saying these things in the beginning. I mean, we were excoriated, demonized, you name it. We were attacked by the left, by the government, by the CDC. We were told by the CDC, we had to pull our information down and things like that. And we were like, no, you're lying. And we know you're lying because we're government trained. And so, it was just crazy. And we knew this was going to cause great harm. And so when that study came out, it did not make me feel vindicated. It made me angry. Yeah. Because this was totally avoidable. We knew this was going to happen. We warned this was going to happen. We tried to wake people up and get people to listen and get educated on the facts. But because they didn't, people have died.
And this is the study right here. Am I pronouncing that right? The Fojo effect?
Yeah. Yep.
Okay. Is this, and I read through it, would you consider this a credible study?
Well, this is not a randomized controlled trial. Okay. Okay. So we have to understand that. Sure. But it is observational in nature. And he's got a lot of factual information there. So I would not say that this is a randomized controlled trial. He does say it's an observational study, but observational studies, if they're done in the appropriate manner, are very credible. For example, Dr. James Taylor of Michigan just submitted an observational study from his practice that he's been doing, and it's one that I'm going to get to you, where he has been tracking his patients very carefully, the patients he's treated, the outcomes, if one patient wants to do this or one patient wants to do that, and the outcomes. So that is a very credible observational study by a doctor who in an unbiased way just documented the results of his own findings. So observational studies can be very credible if they're done effectively. Okay, so this was an interesting one to me because I actually predicted this. So when I saw this, I thought, well, it's been enough time now for us to actually start tracking some of this.
Right. Yeah. And he looked at, it was the counties in Kansas, where there were mask mandates in place and counties where there weren't any mask mandates in place. And he compared the data and concluded that face masks actually contributed to COVID-19 case fatality rate. And that, I guess I can't say I'm surprised.
No, not at all. Not me either.
Everything that I knew 2 years ago after when I looked into this myself, and to me, it just seems intuitive that putting a cloth mask on and wearing it for several hours, doing that on a daily basis, that just cannot be healthy. It's not good for you.
No, it's not. It's actually quite dangerous. And the prolonged mask wearing, see, this is why, and people will argue with me and they'll say, well, I'm a doctor, I'm a nurse, and they get really angry. I wear one all day long. And I say, yes, you do, because you work in a very carefully controlled environment, and people like me supervise your mask wearing. And we will not even allow you to work in a mask if first you don't pass the medical test. Okay, you've got to be physically fit enough to tolerate working with your mouth and your nose covered, restricting your gaseous exchange because it's very taxing to the cardiopulmonary system. And this is why people have had heart attacks by working unsupervised with their mouth and their nose closed. So the first thing that we do, or covered, I should say, first thing we do is we do a medical clearance on you. You have to be able to pass a medical fit test to prove that you're strong enough to even be able to tolerate that. If you cannot, we cannot allow you to do that, and we would reassign you to a different task. Okay, pregnant women. It used to be pre-COVID. Pregnancy was something that would preclude you or exempt you from being able to wear a facial covering. Pregnant nurses did not wear surgical masks or facial coverings pre-COVID. They were not supposed to. Or if they did wear a surgical mask, it was a very short time. And then they had to take, excuse me, what's called a work rest cycle break, because we don't want to restrict the breath of a pregnant woman because it will impede proper oxygen levels to the baby, the developing baby. So, and never, ever could a pregnant woman pre-COVID wear an N95 or a KN95. Okay, so that's very, very dangerous. And it's one of the exemptions and one of the rules that I could never allow a pregnant nurse to do that. So yes, you can work in a facial covering, but it's you have to take work rest cycles every so often. Your health is very carefully monitored, things like that.
It's funny, in one of the cases, the Massachusetts case that I talked about, I take a deep dive into what types of rules, regulations each of these states has, and we've seen this kind of been used in some of these court decisions that have struck mask mandates. And in Massachusetts, the Department of Public Health came up with a whole set of regulations called droplet precautions for various types of viruses and diseases. And I mean, I'm talking, there's like over 100 such viruses and diseases that are itemized in this set of regulations. And it was amended in 2017 to include the coronavirus. And I'm not a doctor. I don't know enough about prior coronaviruses and this one, and whether or not they're similar or how different they are. But there were only, from my understanding, from my recollection, there were only 6 or 7 different viruses or diseases on that list for which masks were recommended. Coronavirus was not one of them. And I think that's fun. A lot of these, like you said, a lot of these approaches and concepts are already embedded in our laws, in our rules, in our regulations, in our protocols, and they have just seemed to have been ignored.
Totally. And here's the problem with that. We know that coronavirus or COVID-19 is an aerosolized virus. And originally they were saying droplets.
Yeah.
Well, a surgical mask will stop sputum or spit or droplets. Okay. And that's what they're designed for, to protect the patient, not the doctor. But this is an aerosolized virus. And the exposure, the source of that is the breathing air, because nothing you put on your face is going to stop the spread of an aerosolized virus. Nothing. The only thing that will stop that is, like I said before, that full hood, that fully encapsulated hood that completely seals and isolates the wearer, so they cannot expel. But really the reason that you're putting a healthcare worker in that is to protect the healthcare worker from the environment, the contagion in the environment. So the source, the CDC is playing a wordsmithing game of saying that PPE or facial coverings is source control. But the problem is human beings are not the source. The only way that you're going to control an aerosol that's suspended in the environment in any indoor enclosed building is to completely put people in isolated hoods. Okay, so you can't use that argument because we're not all walking around in completely enclosed, fully, suited respirators. It's not going to happen. So the source is not the human being. It is the ambient air around you. It is the contaminated air. And that's why we already have the protocols for that. We increase our engineering controls and we pull those aerosols up out of the breathing zone. That's all you got to do. Right. So it's just been it's been a crazy approach, and one that's driven me absolutely insane over the last couple of years. Sometimes I feel like my head's going to explode trying to get this, get people to understand this.
Well, many of us are thankful for a lot of the work that you've done, and you've been very helpful in cases in which we've used you. So,
Thank you.
but we're
Good.
thankful for your effort. We're thankful for your courage too, because
Thank you.
I'm sure this has not been without any difficulty as you
Oh, no.
come up
Yeah.
against many dissenting opinions, most of which are usually supported by this large bureaucracy that is somehow invested in these measures.
That's right.
Where would you're with Stand Up Michigan? Where would
Yep.
people go to find any of the work that you're doing or get in touch with you?
Yeah, so I took the position as vice president with Stand Up Michigan, which was an organization that was born out of what I call righteous anger in response to the government's mandates, unconstitutional mandates for one thing, requiring us all to stay home and not work and all of this kind of thing. So standupmichigan.com, you can go to the website there, and we just redesigned a whole new website. And there are some white papers and some peer-reviewed articles that I have written that are on the homepage with some of my colleagues. We actually presented some of this to the CDC and to the White House and to OSHA as a way to get them to understand, we know what you're doing. It's irresponsible. Please change your approach because you're harming people. You're causing great harm to the public. Those resources were written to give people something that they can use to go to their HR department. We even have court cases in there. We have the regulations, the law, why is this illegal, the science, the data, everything is right in there. So at standupmichigan.com, you will find some of those resources, but you can also follow me. I'm on Locals with Stand Up Michigan. I'm on Telegram at Tammy K. Clark. I'm on Twitter now. I'm back on Twitter. When Elon Musk bought Twitter, I re-signed up. I canceled Twitter the day they canceled President Trump. I thought this is insane, but I just signed back up again on Twitter. So you can find me at Tammy K. Clark there. Yeah, and I'm on Truth Social now because there's no censorship, and I can actually say this stuff that needs to be, I can actually share the things that need to be shared. And
Right.
at the Tammy Clark.
I'm on there too.
Truth
I'll
Social.
find you on Truth Social. I'm on there as well.
All right, sounds good.
Well, thank you for your time, and I really appreciate it. And this has been a very helpful conversation. Thank you again, Tammy.
Well, thank you for giving me the opportunity to share the truth and the real science, data, and evidence, which, as you know, is a legal term. It's important that we stick to the truth. So thank you for using this platform to share truth.
Absolutely.